I'm Tony James, an adolescent psychiatrist in Oxford. I work in child and adolescent psychiatry with those between the ages of 11 and 18, although I do work with younger children when I'm on call. And interestingly, part of my job involves working with families and lots of parents who have considerable problems, emotional, behavioural problems as well, and many who have psychiatric problems. And I think that's one of the areas which I think is very interesting, the interface between child and adolescent psychiatry and adult mental health, whether not just a transition I'm talking about now, I'm talking about parents who have frank mental disorders as well. I think for child and adolescent psychiatry it's a wonderful area because the range of abilities one has to draw on and skills is immense, because you have to deal with families, family law, child psychiatry, development, and now the latest developments in terms of genetics and imaging and so on, things like this all seem to congregate upon a developing brain and developing systems, and therefore child and adolescent psychiatry allows one to really put all one's skills, if one has them, to best use. I think that I've always been interested in research and latest findings. I do read the journals, and I encourage trainees to do that as well. Without currying favour, I do think that the appointment of Professor John Geddes, when he first came to Oxford, was actually espousing evidence-based medicine and things like that. And it became very clear to me that was an important area. Professor Keith Horton undertook meta-analysis, Cochrane reviews, and I actually did a Cochrane review and actually just updated it. And so actually that's where it became clear. But one of the things that strikes me was one of the old adages in medicine, that when you had a heart attack, years and years ago, you actually had to stay in bed for 1 to 2 weeks to recover. The net result was many people had developed pulmonary embolism and just died. So what was seen to be a helpful medical practice led to an increased death rate. Now if you have a heart attack, you're mobilised, even though you probably wouldn't want it, quickly. And that's a very clear example of evidence-based going against what seems to be intuitively common sense. And a lot of our treatments are intuitive or common sense and may actually be wrong or harmful. And that's a worry. Oh, well, I think it's an honour, obviously, to be asked to become an editor of evidence-based medicine. And it's a privilege to be chosen. I'm not sure that I actually qualify for it, so I took it up with alacrity, as it were. But it's actually it's great fun, because one is asked to review journals and forced to do so. I think in this busy modern world, one is often faced with actually putting aside duties that really, even though enjoyable and helpful, you just don't have the time. But now I'm forced to do that. And I think it's very good to be kept abreast of latest developments and being able to review that with experts in the field.